Hello, my name's Anna and I'm an ortho-bionomy practitioner working in Ellesmere in North Shropshire in the UK. What I'd like to show you today are some simple techniques to help relieve stiffness and pain in the neck. But before we go into that, I'd like to explain just a little bit about the basic principles of ortho-bionomy so that you have a better idea of how it works and how these simple techniques can help you. Very basically, in the ortho-bionomy, we always work in the free direction. So we move and we hold the body into the position where it feels most comfortable, where there's as little pain as possible. And you can imagine in the position of least pain, where the body feels comfortable, the muscles and the soft tissues will be as relaxed as possible. And being relaxed, they then are able to begin to reorganize themselves. So let's take a look at the neck and see how we can help ourselves to relieve tension and stiffness in the neck. Now, the three main movements in the neck are no, maybe, ooh, that doesn't work very well for me, or yes. And there's a simple technique that we can use in all three of those directions in order to help relieve and release and the tense muscles which are causing restriction of movement or pain. So let's take no first of all. The first thing that we do is test to see which direction it feels easier, feels most comfortable, has the most movement. So if I look to the right, that's as far as I can go there, come back to the center, and I look to the left. And I can look to the left quite a way more than I can look to the right. So looking to the left is my free direction, is where I have most comfort. So what I'm going to do is I'm going to look to the left, but I'm not going to go to the end point, which would be around here. I go just a little bit over than halfway. And then I take my other hand, and you can think of this as a therapist. And my other hand will hold my head in that position, in the free direction. And then what I do is I rotate the head back and press against the hand. So I'm now rotating the head back towards the right, but holding it in position with my right hand. And I hold that for about 10 seconds. So I guess we've probably had about 4 or 5. So 6, 7, 8, 9, 10. And then I come back into the central position again and have a little pause for a couple of seconds. And I repeat that twice more. So again, I go into my free direction, hold it there with my other hand, press against my hand, rotating back towards the right, and count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. Come gently back to the center and take a couple of seconds pause again. And I'll repeat that once more. Okay, so I look to the left, take my hand, hold it in the position, and rotate my head back towards the right against my hand. 3, 4, 5, 6, 7, 8, 9, 10, and come back to center. Again, take a couple of seconds pause just to center myself, be aware of where I am. And now I can retest and see how I'm doing now on the right hand side. As you can see, yes, it's a lot freer on the right hand side. Go back, test the left. The left is still free as well. So I've now got almost 180 degrees free movement there. Okay, so the second direction that we can test is the maybe, the sideways, the lateral movement. Doesn't really go either well in either direction. So first of all, again, we test properly. How far can I go to the right? How easy does that feel? How far can I go to the left? How easy does that feel? Okay, the movement in both directions is fairly similar, but it feels easier for me going towards the left side. So that's the way I'm going to go. I'm going to go to the left. I'm not going to go to the end point. I'm going to take my hand and hold it in that position and push back against my hand, now in a sideways movement rather than a rotation, and hold it for 10 seconds. 4, 5, 6, 7, 8, 9, 10. Come gently back to center and take those 2 or 3 seconds pause. And again. So I take my head to the left, I'll hold it there with my hand, I press against my hand in the sideways lateral movement and count to 10. I had a few seconds, so I'll start again at 4, 5, 6, 7, 8, 9, 10. Come gently back to center. Take a couple of seconds pause. And then a last time. Take it to the left. Hold it there with my other hand. And press against it gently. 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back to center. Take a pause. Oh, lovely deep breath comes. And then I can test, see where we're going. There's the right. That goes a lot further than it did before. Back to center. And there's the left. Okay. And the third direction of movement that we have is the S. Now if I turn sideways, you can see that I can move the head on top of my neck without actually bending my neck, and then I can go down into the bending of the neck. And when I come up, I can straighten the neck, and then with the neck straight, I can just tip my head back gently, not too far. Again, we don't go to extremes, and come back to the center again. And it's that movement that we're going to be testing. The full flexion downwards, and that little bit of extension backwards. And you can imagine the skull as a ball sits on the top of the neck in the first vertebrae, and that rotates on the top of that vertebrae, without that little bone at the top of the neck having to move. And that's what this little gentle rocking is. When the neck stays straight, it's just that gentle movement. Okay, so let's test it. I'm going to the yes. That feels quite comfortable for me, but I can feel it pulling there. And I can go to the backwards extension, which actually feels quite comfortable for me. So what I'm going to do is I'm going to go into that backwards extension. Here, be very, very careful not to go to the end point. We don't need to do that. We stay in the place of comfort. So I'm going to go backwards. I'm going to put my hand on my forehead just to hold it in that position. And then I'm going to push against my hand as if I was going to be bending my head forwards. 3, 4, 5, 6, 7, 8, 9, 10. Come to center. Take this couple of seconds pause. And again. So I take it back a little bit, take my hand, and press against my hand as if I was going to bend it forward. 2, 3, 4, 5, 6, 7, 8, 9, 10. Come to center. Again, you don't need to press hard, just gentle movements. And the last time, I take it back a little bit, I hold it, and I press against my hand gently as if I was going to bend my head forwards. 4, 5, 6, 7, 8, 9, 10. Come back to center. Whew. There's a deep breath again. And then I now can test. So we go forwards. That feels a lot easier. This tension here is still there a little bit, but it's released quite a lot. Come back. And that still feels free too. If I was going to be working in a different direction, which is usually what most people find easiest to bend forwards, I would bend forwards, not to the full extent, but I would bend forwards, take a hand, and again hold my head in that forward position and push backwards against my hand. Hold it for 10 seconds and repeat the whole process. When you've done that, you should feel a lot easier and flexible, and with a little bit of luck, have a lot less pain in your neck. These techniques are very simple. They can be quite effective. There are absolutely no promises behind these techniques and no guarantees. What we're doing, we're working with the symptoms. So we're not getting at the cause necessarily of your stiff pain or your stiff neck or painful neck. And in that instance, yes, they're excellent self-help techniques, but it does always help to get to a proper orthobionomy practitioner and have a full therapy session in order that you can get at the cause of where your neck pain is coming from, which may be from your shoulders, which may be from your upper back, which may be from a misaligned pelvis. Okay, but anyway, hopefully these will help you in your times of need, and yeah, maybe we'll see each other again sometime. Thank you.